Look, to top it off, Mr. Secretary, I got a copy of H.R. 944. Do you know what it is? It's your impeachment articles, sir. You have abused your office, you have gutted America's public health, and you have sacrificed our leadership in medical research and innovation. Americans today are less safe under your watch. Children are dying of diseases that we thought we had eradicated. You can smirk, sir, but I answer to the people of Michigan, and they have told me you should be ashamed, you should resign, and if you refuse, Congress should remove you from office. I yield back.
A sitting United States Congresswoman just held up impeachment articles in the middle of a Senate budget hearing and read them directly to a cabinet secretary's face. No warning, no procedural preamble. She had spent 3.5 minutes building the record: measles deaths, vaccine sabotage, children hospitalized, and then she produced the document. Robert F. Kennedy Jr. smirked. She called that out too. What you are about to watch is what accountability looks like when someone has actually done the homework.
Thank you, Mr. Chair, for holding this hearing, and Mr. Secretary, it is in fact true. I come from the great state of Michigan, and as you enter your second year as our nation's Health and Human Services Secretary, I just had a few things I wanted to tick through with you here today. So in early 2025, after your confirmation, measles cases spiked in the United States to the highest levels since 1991. Last year, we had over 2,200 cases in America. 3 people died. 2 were children. Do I have that correct? Because according to the CDC and the American Academy of Pediatrics, I do. During this same time,
that epidemic started before I came
during
into
this
office.
same time, you questioned the effectiveness of the measles vaccine. And then in September, your hand-picked vaccine panel voted against recommending the combined measles vaccine for children under 4. This is true?
It was dangerous.
We know
that
now that
particular
over
version.
90% of measles cases in 2025 were among people who were unvaccinated or whose vaccination status was unknown. That's correct? According to
You
the
think
CDC,
we should have given
it
a
is.
dangerous vaccine that all the
In
science
just the first 3.5 months of 2026, the year we're in right now, we've already seen an additional 1,700 measles cases. I assume you're aware of this, according to the CDC.
There's a global epidemic.
You have also pushed vitamin A as a treatment for measles. That is correct?
Yeah, every
According
major
to
health
the America's
organization in the world
Poison
recommends
Centers,
it.
vitamin A overexposure among children increased by nearly 40%, and in this time frame, children in the hospitals with both measles and unsafe levels of vitamin A has occurred, correct?
I'm not recommending unsafe levels. I'm recommending what every
The
major
Americans-
international health
Poison
organization
Centers,
recommends.
The American Poison Centers agrees. You characterized your response to one outbreak in Texas as a model for the rest of the world, even as the number of measles cases climbed. As Secretary of Health and Human Services, have you ever taken steps to undermine medical guidelines rooted in science? Because we can look at your record, sir.
Oh,
I serve on the Science Committee. At the beginning of this year, the CDC tried to slash the childhood vaccine schedule from 17 recommended vaccines to 11 before it was blocked by a judge. Hepatitis A, B, RSV, multiple vaccines were demoted. Do you dispute this charge, sir?
You think that we should recommend interventions
These vaccines
that have not been safety
have saved
tested?
countless lives. A 2024 study estimates that childhood vaccines have saved 1.1 million children's lives and prevented more than 500 million illnesses in the last 3 decades. Doctors, researchers, and medical experts have spent years working to not only understand illnesses, but also prevent them. Your actions restricting these vaccines have a grave impact on our country. And while you have waged war against established medical science, you've also attacked life-saving research on cancer and Alzheimer's. You have implemented measures that have raised costs, kicked families off their insurance, and made it harder to get coverage.
You're just making
Devastated
stuff
rural
up.
hospitals. Look, to top it off, Mr. Secretary, I got a copy of H.R. 944. Do you know what it is? It's your impeachment articles, sir. You have abused your office, you have gutted America's public health, and you have sacrificed our leadership in medical research and innovation. Americans today are less safe under your watch. Children are dying of diseases that we thought we had eradicated. You can smirk, sir, but I answer to the people of Michigan, and they have told me you should be ashamed, you should resign, and if you refuse, Congress should remove you from office. I yield back.
The gentlelady's time has expired. I now recognize the gentleman from Missouri, the good Dr. Under.
Thank you, Mr. Secretary. Thank you for being here. I'm glad my colleague got her little X clip there. Hopefully it'll go viral for her like she intended. Secretary, thank you so much for your work on just so many areas. But one of the things I wanted to highlight today was your work on prior authorization that was used too often to deny patients of the care they need. But I think what we're seeing, I'm a practicing physician, practice very little now that I'm in Congress, but now more and more we're seeing threats to patient access because insurance are allowing doctors to give patients the care they need, but then denying payment for those cares. And this isn't the usual, fight over physicians getting reimbursed. An example from my own specialty, I've been contacted by dozens of allergist immunologists around the country that United Healthcare is claiming to follow Medicare, dishonestly claiming to follow Medicare on allergy immunotherapy and reimbursement, allergy shots, and completely denying care for that very life-changing, reimbursement for that very life-changing treatment. Given the market power of United Healthcare, this will put this particular therapy out of business within, I would say, 6 months to a year if UHC's policy continues, for 45 million United Healthcare insured patients. So I think we need to watch that, not only the barriers to care up front, but if insurers can arbitrarily use their market power to deny reimbursement, that care will go away likewise. But,
Yeah, I mean, I have children with anaphylactic allergies.
Yes.
And some of them have benefited from these, these allergen medications. I have a son who literally lost his peanut allergy, which every doctor told him.
Yeah, that's oral immunotherapy.
Would never happen.
Yes. That's oral immunotherapy, which is relatively new, and I don't think any insurer actually reimburses for that. But then aeroallergen immunotherapy, pollen, mold, dust, and so on, that used to treat asthma, sinus disease, allergic diseases, is mostly what United right now is.
This is the first I've heard of it.
Yes.
So, and I have two guys who are sitting behind me, Chris Klump and Ken Callahan, who will be interested in helping you with this. Let's get them together with your staff.
I appreciate that, Mr. Secretary. And I want to commend you, and my colleague, Representative Miller, highlighted this, your work to protect kids from mutilating transgender procedures. Of course, I think most impactful, immediately impactful, was the denial of Medicare and Medicaid reimbursement to hospitals who insist on mutilating kids, despite the science, including the recent Finland study. But one thing that really just monumental development, I think, is the executive order that President Trump transmitted last January. It had a number of components, including directing the HHS study that came out later last year, but also directed the Department of Justice to work on a bill to create strict liability for those healthcare providers who would exploit our kids with mutilating transgender procedures. I am honored to be carrying that bill in the House. It's the Chloe Cole Act Senator Blackburn is carrying in the Senate. I believe that strict liability, the ability of parents and children, young adults, to hold those who exploited them with these mutilating procedures accountable could be very impactful, just as we saw the AMA and the plastic surgeons change their position on mutilating procedures after the big verdict in New York. Do you think it's time that we be able to hold those who harm our children in this way strictly accountable.
It makes a lot of sense to me. The science is so clear that this is a harmful procedure with very little evidence of any benefits. We'll work with you on that.
No, I appreciate that. And the one talking point that these transgender doctors, I have a hard time even calling them doctors, but these quacks say is this is going to improve kids' mental health, prevent suicide.
Well, there's no evidence of that.
There's no evidence of that, and the Finland study showed that girls who are gender confused who undergo these procedures, their serious mental health issues double, and boys, they go up sixfold. So I think there's never been a good evidence, and now there's abundant evidence that we're doing more mental health harm than good.
I thank the gentleman.
Thank you, Mr.
Thank
Chairman.
you, Doctor.
What you just watched was not a stunt. It was a closing argument delivered in 4 minutes and 10 seconds. The Congresswoman from Michigan did not walk into that hearing room to ask questions. She walked in with a case already built. She opened by establishing the factual record point by point, and she made Kennedy confirm each one himself. Measles cases surging to the highest level since 1991. Over 2,200 cases last year. 3 deaths, 2 of them children. Kennedy's own vaccine panel voting against recommending the combined measles vaccine for children under 4. More than 90% of 2025 measles cases among the unvaccinated or those with unknown vaccination status. Vitamin A overexposure among children rising nearly 40% during the same period. An additional 1,700 measles cases in just the first 3.5 months of 2026. She did not editorialize. She asked him to confirm. He confirmed. Then she widened the frame. The childhood vaccine schedule slashed from 17 recommended vaccines to 11 before a federal judge blocked it. Cancer research gutted. Alzheimer's funding cut. Families kicked off insurance. Rural hospitals devastated. Each charge landed on top of the last, and Kennedy had no rebuttal because she was not asking for one. She was reading a record into the congressional transcript, and he was sitting there providing the receipts. The impeachment articles were H.R. 944. She named the bill number out loud, held up the physical document, and asked Kennedy if he knew what it was. He did not answer. She answered for him. Abuse of office, public health gutted. Medical research and innovation sacrificed. Americans less safe. Children dying of diseases this country had already beaten. And then Kennedy smirked, and she caught it. "You can smirk, sir," she said, "but I answer to the people of Michigan." That line matters because it reframes the entire exchange. He answers to the president. She answers to the people watching children get sick. Those are not the same constituency, and she wanted that distinction on the record. The Republican who followed her immediately tried to reframe the moment as a social media play. Hopefully it'll go viral for her like she intended. That tells you everything about how shaken the room was. When the best response the other side has is mocking the format, the substance has already landed. And the substance here was a sitting cabinet secretary sitting in silence while a legislator read out the reasons Congress believes he should be removed from office. Watch for what happens to H.R. 944. Impeachment articles introduced in the House require committee action to advance. The question is whether this hearing, and the week of testimony that preceded it, builds enough pressure to force that vote out of committee. Kennedy has now testified 7 times in 1 month. Each hearing has added to the record. This was not the end of that record. It was a chapter break. If you think a congresswoman holding up impeachment articles in a federal hearing room is something the people around you need to see, you already know what to do. Share this. The people who should be paying attention probably are not looking for it.